We view this as an informal opportunity for some of our elected officials and city staff to work with you as our media partners so that we can start to be a little more proactive in how we communicate within the city. We know to some extent we'll have some direct news for you to report on that you can use at your leisure. Some of what we will do, you'll recognize, is starting to provide some background, so that as we get to future council meetings and future stories, you've got some of the background on what's going on. We really want this to be interactive. We appreciate your feedback and certainly questions as we go. And at the conclusion, we can talk about when is a good time and what are appropriate topics that you would like us to cover in the future. For today, we are going to go through our annual reports from both the police department and Watertown Fire Rescue, sharing what they have accomplished in 2025 and looking at some of the statistics that you have in front of you. And then after that, I thought I'd give just a bit of foreshadowing what is coming up on our next council meeting, in case there's some things you'd like to look at or dive into in advance of that meeting. I will just say it's a pretty light agenda without any major topics. And then finally, any questions you were not able to ask during the presentation and event, certainly we'll make some time at the end to ask those questions. So with that, I'd like to turn it over to Chief Toomey.
Thank you, City Manager. Welcome, everybody. Thank you for coming to this inaugural event. Thank you to the City Manager and the work that the PIO, Kelly Fritz, and IT Director Peter Boyle put into this. Like Alan said, wanted to be really informal, so please ask questions as we go. Before I get started, I just wanted to talk a little bit about, this is a public safety briefing, and there's a lot of great things to happen this year. It's going to be a great report, and I'm really proud of my department. But I really want you to look at public safety and police department and fire department as kind of the foundation of public safety. It really is a wheel, and we're just a spoke in that wheel. If we didn't have a strong city organization that we have, good street department keeping our streets clean, garbage getting collected, community development working hard, HR keeping our employees motivated, a great city leadership, a great city council, Watertown wouldn't be thriving, and we wouldn't have the quality of life which predicts crime prevention. Your crime rate is reduced if people are happy. So along with that, we have to thank the community, right? If we didn't have the strong businesses in town, if we didn't have the strong churches in town, if we didn't have the strong schools in town, if we didn't have the amenities of our lakes and our bike trails and all the great things that we have in Watertown, we wouldn't have public safety. The crime rate would skyrocket. So today's presentation from the police department side is you're going to see that we have a significant decrease in crime in Watertown. And I wanted to thank everybody, our community partners, everybody that we work every day with for that reason. And I'm just really thankful to live in Watertown. So I'm going to go through a presentation quickly. Again, feel free to ask questions. Each one of you has our annual report. Just a little bit about the annual report. It's broken down as sections. The first section, after you get through all the oath of office and all that other stuff, you'll see calls for service. It's important that you distinguish the difference between calls for service and arrests. Calls for service is just simply what the call came into dispatch as. So say somebody reported their car stolen, so it would be labeled as a stolen vehicle, but officer arrives and figures, oh, he just forgot where he parked it. It's still labeled a stolen call, so a stolen car. So calls for service is what we were initially dispatched for. The arrest is what actual arrests were made. Traffic citations, arrests, that's an important part of it. And then finally at the end is it's broken up by division. So you'll see how many traffic stops patrol make, how many cases the CID investigated, how many mental health calls we had. So it's broken up intentionally in that way. In the room today, I got my command staff, so if you have any questions that I can't answer, they can answer. I got Kirk Ellis from our patrol, I got Ryan Beauchamp from our community engagement, and Steve Rehorst from our CID. So I'm extremely proud of our department, and on the screen you can see it. This is our makeup. We have 61 total employees. These guys and girls with the total, almost 8,000 hours of training between dispatch and patrol. They're highly trained, they're highly motivated, they're highly dedicated civil servants that are accountable to this community. I'm really, really proud to be a part of that team. Everything I tell you today is their accomplishments, not mine. It's the strong team that we have and the strong leadership that we have for that reason that we're so successful. One judge is our turnover rate. You know, traditionally it's been really hard to keep officers, but we're seeing that improving on a yearly basis. An average turnover rate nationally is about 10% for law enforcement. We're at about a 7.15%. So we had one retire, Chad Stricker's retired, we had one resign, went to a different department, and then we unfortunately had to terminate one of our officers. Communications, on the other hand, they had 3 resignations. It's you know, it's a tough job in there, and it's tough to get somebody to have that fit. So we're working hard to reduce that turnover rate. But reason why we have such low turnover rate, again, goes back to that quality of life. You know, you have to pay them right, you have to have all the benefits and everything, but it's the quality of life here in Watertown that keeps people here. So we look for people to hire that fit our community. But you can see that just shows you over the years the difference in turnover rate. Last year we had a significantly higher turnover rate, and at the end I'll show you a graph on our internal affairs investigations, and you can see a correlation there. So accidents, this is kind of our bread and butter. We got to have a roadway safe. Our accidents, about 5 years ago, we set a standard that we wanted to be below 700 accidents in Watertown. Largely dependent upon weather, obviously. A mild winter, we're going to have less accidents. But that number continues to decrease because of that we embrace technology. We are putting a lot of investments into our traffic safety team. We have staff packs. We take advantage of highway safety grants, you know, deploying officers to resources, to the areas where we need them most. It's called hotspot policing. So what we'll do is we'll deploy a staff pack. You know, say, Holly, you call in, there's people speeding down my road every day. So we'll go out, we'll put a stat pack up on a pole, and that just checks the speed of all the cars, and it will help us determine, yeah, should we put some patrol officers out there, or where are they better used in a different area of town? So accidents are important. A little bit about accidents. We had 425 state reportable accidents, and what that means is serious enough accidents with the value of damage or injuries has to be reported to the state. 425 needed to be reported to the state. Out of those 425, 24 of them were alcohol related and 8 of them were drug related. So in a little town like Watertown, we still have an issue with that. We'll talk a little bit more about that here in a second. Any questions about accidents? Okay. Citations and warnings. This is a good gauge on how active our officers are. The city manager and I were jokingly talking about Sir Robert Peel, who's the founding father of law enforcement. He has 9 principles. And those principles he made in 1829, him and his commission. And if you get a chance to research it, I would look them up because those principles apply to today's law enforcement. One of them is you can't really judge how a city is doing by the presence of police, about the activity of the police. The only way you can really judge your crime rate is by the absence of crime. And that's our goal. It's not to be out there arresting people and putting them in jail. It's to deter crime and make it safe for everybody. So 4,847 traffic citations were written. We like that, or no, warnings I mean. 4,847 warnings were written. 2,578 citations were written. So that's a good ratio, right? We try and educate people. We don't want to automatically just give a citation. So that's a good ratio. It's about a 50% ratio. DUI arrests. This is a concerning topic. It's been a concern of mine for a while. 4.6% of our traffic stops result in a DUI arrest. 4.6% of all traffic stops. In the nation, they measured by arrests per 100,000 people. And in the nation, the average is 300. 300 people per 100,000 are arrested for DUI. In South Dakota, it's 200 or 750 DUI arrests per 100,000. So nationally, it's 300. We're more than doubling that in South Dakota. Watertown is about that same. 13,500 people die each year in alcohol-related accidents. Peter, did you have, give me 5 minutes?
No, 5 minutes.
No, it'll be longer than that. But, 35 to 40% of our traffic fatalities in South Dakota were alcohol-related.
What percentage?
35 to 40% of fatalities were alcohol-related in South Dakota. So that's a serious concern. So why is that? Why is South Dakota so much higher? Well, you got to think of our population, right? The population is lower, so that number is going to be higher based on it's more like per 10,000 instead of per 100,000. We also have seasonal events like fall hunting season brings people in, and those types of things. But the most important thing is we put an emphasis on keeping drunk drivers off the road. So our guys are out there constantly looking for people who are drunk driving. So we're not suffering those fatalities. So that's a number that we're going to continue to work on. We did apply for and was successful in getting a highway safety grant. That's going to deploy some officers for overtime out there specifically looking for drunk drivers. So with Ubers and everything else, I just really would encourage the community to think twice before you get behind the wheel.
Chief,
Yes, sir.
you said this morning we were talking the DUI arrest for teenagers.
Yeah, so that's a good point. So under 18, how many DUIs do you think we should have in Watertown for kids under 18? What's a good number?
None. Should have.
None. I like
None.
that.
How many do you think we have?
45.
Oh, thanks. No, it's not that bad. But we had 10. 10 kids under 18 who chose to drink to the point of intoxication and get behind the wheel. That's a serious concern. It takes one to turn out in front of that family, So that's something we'll be spending a lot of time on. Okay, bad news. Now the good news. Crime is down in Watertown. We are doing really well. Violent crime, major crime, all down. Incredibly down. It's not only in Watertown. I just watched Sioux Falls public media address it, and they're seeing the exact same thing. Burglaries. Look at that graph. I mean, that's incredible. 42% since last year, 50% over a 5-year average in burglaries. Thefts are down. And why is that? Why is crime down? Yeah, it's because of the hard work of the men and women of your police department. They're out there every day working really hard. But again, it goes back to that quality of life. If people are happy and they're satisfied, they're making a wage, and they got a roof over their head and food in their belly, they're less likely to go out and commit crime. And we have social services now. We're so interconnected with outside agencies. Everybody wants to work together. I've never seen it before in my life, in my career, that the interagency collaboration has just been incredible. Anywhere from the courts to, we have a very strong prosecutor now who's willing to prosecute and go after these offenders, to the problem-solving courts like drug court and those types of things. There's services out there for everyone, so everybody's feeling that good quality of life. Watertown, if you look up crime rate in Watertown, I did, and there's some that says it's a little higher, but I found average of 37% lower crime rate in Watertown than in the nation. 32% in South Dakota. So Watertown's doing really well. Thefts are another good example. 27% decrease in thefts from last year. So that's a good sign, and that's a trend that we're going to keep hoping to see happen. Assaults, domestic and non-domestic. So a domestic assault is something that happens within a home, right? It's some sort of relationship versus just if they don't know each other or aren't related to each other. Great news is aggravated assault is down. It's 56% down. I saw a slight increase in simple assault, which is 7%, but what that tells me is that we're intervening at an earlier stage before the violence escalates over time. Yes, sir.
You were probably going to get to it, but what's the difference between simple and aggressive?
Yeah, great question. Aggravated assault is your serious assault. It causes serious bodily injury, or it could cause serious bodily injury, or a weapon is used. So simple assault is just maybe somebody gets punched or slapped, and it's not really causing serious bodily injury, but some sort of injury. So those are great. Those bottom graphs, the brown and yellow, great graphs are going down, and that's what we would like to see. We still have some work to do in the family disturbance and domestic side of it, but I think when you see an increase of 7%, what that's telling me is people are okay to call us, right? you know, maybe before they wouldn't trust the police to come to their house and they're not gonna do anything anyway, they're now calling us and we're responding and we're actually helping them solve their problem. So it's problem-oriented policing. And it's great. Drug arrests. This is an incredible graph. This is a story to tell. Why did we go from 991 arrests in 2018 down to only 388 arrests? And I think the answer is pretty obvious. It all surrounds marijuana, right? It's the legalization in other states, it's the medical marijuana, it's the lower perception of it, perception of risk. It's the ability to prosecute when you have, you know, all sorts of derivatives, Delta 8, Delta 10, Delta, you know, all these different derivatives. So the focus, our focus at the Watertown Police Department has been on the serious drugs, the methamphetamines, the fentanyl. And we have had record-breaking success in that area. Under the leadership of Steve Rehorse, our narcotics detective is working extremely hard to get to the cause, get to the dealer, to the distributors. We've had a record-breaking seizure this year. It was over a pound of methamphetamine, which somebody asked a question earlier, how much does one person usually buy? And a user would usually buy, you know, maybe a half a gram or a gram. So if you take a pound and break that up into grams, so that's over, what was it, 400 and something?
453.
It's almost 500.
Almost 500 grams of sales. So we're doing really well in that area. We have a lot of work to do. We take a proactive approach through education, to enforcement, to really reduce those numbers. The interagency cooperation with DCI and Sheriff's Office and all that has been, you know, the best it's ever been. So I think we're really making some headway in that area. We made 18 distribution arrests in Watertown. There's more coming, and my advice to anybody who wants to or thinks they're going to come to Watertown and sell drugs, they better think twice, because we will catch you and we will hold you accountable, and we have a prosecutor that's willing to do it. So don't come to Watertown to sell your drugs. All right, this is a pie chart, just breaking it up on kind of give you a visual on what it looks like. 33% of our time is arrests for on controlled substance. The drug paraphernalia is another one, but again, we want to reduce that number, and how we do that by working together. We work with our courts, we work with our social services, get people help that they need if they're addicted or if they're using, and we'll get that number down. All right, this is why I became a police officer, in protecting our kids. This number is concerning, right? We went from, 6 arrests last year in 23, all the way up to 29 arrests. These are arrests for child abuse. If you look at the calls for service, reports are down. It's down about 16%, but arrests are up. So why is that? It's because we're doing a much better job at investigating this. Again, we have a strong prosecutor that's willing to go after these people. We have the REACH clinic that is a collaborative effort between many different agencies. So our patrol officers are identifying it, our detectives are investigating it, and we're holding the people accountable, because we will not tolerate people putting their hands on kids. So I think we're gonna see something good in the future in that. I would be remiss if I didn't mention our 911 center, because they do incredible work in there. Over 54,000 calls for service, or calls come into that center. All calls, including 911 calls, are answered within 10 seconds, 97% of the time. That's incredible. We dispatch for 6 different counties. In Watertown alone, we had 24,866 calls for service. 24,866 calls in Watertown. How many people live here? Less than that many, so at least 1 call per citizen in Watertown. You'll see on the right side a pie breaking up in districts. I'd like to point out the lake, 942, that's a new stat we're collecting. A couple of years ago, we developed a lake patrol, so we take summertime employees like our SROs and we dedicate them to the lake, and we're really seeing some gains over there, and I think the lake folks are really appreciating it. All right, here's our accountability slide. Accountability is extremely important to me. I want nothing but the best officers out there serving our community, and we will always strive for that. Out of 24,866 calls for service, we generated 20 complaints for the year 2025. That's pretty good. 10 were not sustained, 11 were sustained, 10 were unfounded, and 1 was exonerated. it's important to know, there's a graph of what they look like over the years. It's important to know that although we had 33 allegations, that doesn't mean 33 separate officers. One or two officers probably accounted for most of those complaints. And if you remember the graph for turnover, let's go back real quick. Oops. Kind of look similar, right? So when our officers are doing bad things, we're going to get rid of them. I guess I got no other way to say that. So that's about it for me. These are our goals for 2026. Yes, sir.
Who investigates those complaints? Is that an internal investigation that you conduct?
That's a great question. If it involves any criminal allegation whatsoever, no. The PD does not investigate criminal allegations. We automatically refer those to the DCI. If it's a policy violation, a rudeness complaint, maybe somebody didn't do it like that, Assistant Chief Ryan Rembers is our internal affairs investigator. He's really, really good at it. And I want the public to know that we are totally unbiased and we would like nothing more than weed out bad cops. So I don't think we have any, but we're human, right? We're just, Sir Robert Peel's principles, number 7 is we're the public are the police and police are the public. We're just members of the community getting paid full time to pay attention to the things that's incumbent upon all us citizens. So that's my presentation. I went a little over. Sorry, Pete. Questions?
When you get an officer complaint, what would be some examples of a termination type offense versus, and if it's not, what kind of work do you do with that officer to take corrective measures so you can keep them on the force?
Great question, Mike. So everything is governed under our policies, our city personnel policies, and the bargaining unit. So there's certain things that we are immediately, you could be terminated. Things like lying, stealing, those moral things that you can't be a cop. If it's simply a performance issue, maybe you ran a stop sign, or maybe you lost your temper, something that we could train somebody on, that's what we do. So there's a whole spectrum of discipline. It can go from anywhere from just a full warning to a written warning to suspension to time off with pay, without pay. So it all depends on the infraction and also the history, right? So if we put somebody on a work improvement plan, after 6 months they're not improving, then we got some hard decisions to make.
I got a follow-up question too. You mentioned that you made 18 drug distribution arrests and more are coming.
Yes.
Where are these drugs coming from?
That's a great question. If I knew that, we'd plug it the hole in. Most of our drugs come from the southern border, I would assume. But again, they could come from anywhere. So, yeah, it's the organized criminal, what do I call it, Steve? Organized crime.
The cartels?
Cartels, you want to say it simply, yes. Yeah.
Regarding the serious drug arrests, or you focused upon fentanyl and meth. Is there one of those that are more prevalent in this area?
Sure. Yeah, meth. Meth has been and will continue to be most prevalent in Watertown. The problem with it is fentanyl is so much more dangerous, right? It takes just they have the saying, one pill can kill. So what we're getting is these counterfeit pills that come from usually the southern border and the press down there, but you don't know where the fentanyl is concentrated on. So people are smoking these things or maybe cutting them up and taking the pill, but one side of the pill might not have any fentanyl and one corner of the pill has all the fentanyl. So one pill is going to make you overdose. We're working really hard. We have the Narcan distribution boxes out there at the hospital and at the library. There's a lot of social services going on to really get in front of that. It's definitely an epidemic, and we'll do everything to keep that out of the hands of our kids. Yes, ma'am.
How much fentanyl can kill you?
A microscopic amount. It depends on your tolerance. It's just, I don't know. Steve, you want to answer that?
That's pretty accurate. I believe like the size of the tip of a pencil.
Yeah, it's crazy. And you don't know. I mean, then there's cart fentanyl, and you don't know what they're doing with it, and but we do see other drugs. I mean, occasionally we'll see cocaine again, or heroin, or mushrooms, or those types of things. So Watertown's not immune to the drug issue.
You didn't talk at all about distracted driving.
Yeah.
When I'm driving around town, I see kids driving, looking at their phones all the time.
Yeah.
All the time.
Yeah.
It's not just
So-
kids either.
Pardon me?
It's not just kids.
No, it's not. So what can you guys do about that in terms of, I don't know, enforcement or an education campaign or whatever?
Yeah, that's definitely gonna be one of the goals for the traffic safety team this year, to really look at that. It's a very difficult thing to establish enough reasonable suspicion, because it's still legal for somebody to make a phone call on their phone. So you have to be able to observe somebody long enough to say, yes, they are texting and driving, or are they just dialing a phone number, and then you stop them, and it's a serious thing when you stop somebody, because you have the constitutional right to travel freely on our roads if you're licensed. But when we stop somebody, it's taking away their right? It's a Fourth Amendment. We're seizing them for a moment in time based on reasonable suspicion. So we want to make sure our stops are 100%. We have enough reason to stop you, if not more than that. And texting and driving is a hard one. But we could put somebody at a corner in plain clothes just watching it, as people are stopped at stoplights, and then having an officer down the road and such things. So we're looking at strategies. We were thinking about going around with transit, getting on their bus and just looking out the window of their bus and seeing who's doing that. So education is a big part of that, and showing how dangerous it actually is. And I believe that contributes to the under 700 accidents that we get. I think texting is a big one.
I've got one last question for you.
Sorry, guys.
So when we look at crime in general, that leads me to wonder, do you have the manpower or the staff that you need that's adequate? And do you have all the equipment you need, or do you have more things on your wish list?
We have a very supportive council and a very supportive city manager, so we do get the resources that we need. Could we use more officers? Absolutely, we can always use more officers. We have some shortages coming up. Coincidentally, we have how many? Seven officers who are either the male half or female officers that are pregnant, and they're all going to have their babies right around the same time. So that means 7 officers are going to be, off work, out of work with maternity or paternal leave. Is that what it is?
Maternity.
Paternity.
Maternity or paternity.
Yeah, those two things. So that's a challenge. So we're looking at the staffing shortage, but yeah, we could, if you fill out an application, we'd love to have you.
How about equipment?
Equipment we're doing really well on. We're, with these guys, our command staff is constantly looking at how to make things work better with less, right? So technology, we're really embracing technology. This year, the city manager has approved us for a drone. So this drone is going to be a state-of-the-art piece of equipment that's going to be able to do overwatch. So if we have a serious accident on Highway 212, the first officer on scene can fly this drone over and have, and have overwatch of the scene and be able to tell was there a hazardous spill, or maybe it's a search warrant, a high-risk search warrant where we'll have overwatch. So we're constantly depending on technology to
Structure fire.
a structure fire. So those are all force multipliers, right?
We are not going to act this far in advance yet, but the technology is there that we could launch a drone from the 911 center. So as soon as a call comes in, the drone could be the first resource on the scene, so before anybody else arrives, they know exactly what's there.
Just think of how well that'll improve officer safety on a response, and it's going to save lives.
How is it controlled then? Once it leaves the 911 center, how does it know where to go and who gets it there?
That's the magic. I don't know.
So we would have a pilot in the center that would fly remotely to Overwatch, and then we have how many pilots? Five or seven pilots that are 107 certified that could take control of the drone once it's there. Not only are we going to have the patrol drone, and this thing is going to be neat, because say we have an Alzheimer's patient that wanders away, we can launch this drone and program it with a pre-recorded program, so it will do coordinates. So we could say, fly to this coordinate, make this announcement. It's got a really loud speaker, and we'll say, hey, we're missing Sally. She wandered away. She's wearing a pink dress, and if you see her, call 911. And then we'll go to another section of that town, and another section, and keep doing that until we find that patient or that missing kid or whatever. So when you're talking about staff shortages, my God, that's a force multiplier, right? That's like having 5 more officers. but it's $50,000 a year versus, you know, whatever an officer costs plus benefits and all that other stuff. And to supervise a drone is a lot easier than supervising a human, so.
When will you have it, by the way?
It's on order. It should be here sometime in March, is what we are told. We do currently have drones that we use on a daily basis with SWAT operations, and if we have, I remember one success story. We had a suicidal suspect over Lions Park, and the drone was able to fly around Lions Park and actually find the suspect. Luckily, he was okay. But again, those are the technologies that we'll embrace. That's one of our goals. Modernization, operation through technology, communication, and transparency. So, good question. I'm not going to take up all the time. We've got some important people coming up behind me. Thank you. If you have any questions, feel free to contact me at the office. I would really encourage you to read through this and reach out with any questions. Thank you.
Cheers.
Yes, thank you.
Okay, we'll get into Watertown Fire Rescue's presentation. Thank you all for coming again. I know everyone in the room here, so we'll skip introductions, obviously. But that stated, everybody knows who I am, Fire Chief Rowland, and I've been in the department now a long time, 30 plus years. I've been the chief now almost 5 years coming up, and I can tell you lots changed since I've been chief. We've had a lot of successes, continued technology gains, a couple staff increases over the last couple years as well. That stated, we'll just kind of touch on our personnel a little bit. Our personnel is kind of one of the biggest things for me as the chief in our department. Our organizational chart structure is 40 full-time strong. Consists of obviously the fire chief, my colleagues in the room, Assistant Chief Youngblood, he's my operations chief, EMS Chief Gary Langrock's in the room back here. He's in charge of all our compliance, a lot of our EMS training within the facility, as well as our medical supplies and operative IQ inventory process for our ambulances. And then of course we have our Fire Marshal Adam Bloom. We'll talk a little bit about his role in the department. We have 3 battalion chiefs for all 3 shifts. There's 12 people per shift. Within that 12-person structure, there's 2 lieutenants on each shift, which are 6 lieutenants then. We have 9 fire apparatus operators, and their job is to be the lead engine for our fire trucks. We have 2 of them at each station that are lead apparatus operators. And then of course we have 18 full-time paramedic firefighters within the department as EMTs as well. And then we have 3 part-time staff. And the 3 part-time staff are kind of interesting and unique folks, because we have the Med Fire Rescue program that we co-op and partner with and collaborate a little bit at Lake Erie Tech. And without that Med Fire Rescue program up there, we'd have some shortfalls when it comes with our staffing. And a lot of those part-time folks work on weekends when we're low census. You know, PTO, time off for staffing is out there for everybody, and weekends are the hardest time for us to have a full shift. And these folks are staffed, and Operations Chief Youngblood handles that timeline as far as what they work, and he assigns each one of them to a shift. And the nice thing as well is we do have low census during the week. We can call those folks in to help identify a shortfall on A and B, C shift. We had a couple of retirements last year. We had Battalion Chief Tyler McElhaney retired. He retired last August. He had 30 plus years of service. Lieutenant Chris Nolner also retired about a month later. And we had 3 promotions on top of those retirements. We had a lieutenant that was promoted to battalion chief. His name is Adam Heinrich. He's our new battalion chief on C shift. And we have 2 lieutenants that promoted within that fire apparatus operator ranks, CJ Robinson and Andrew Seebeck, respectively. And we had 4 new hires on top of that. I know Chief Toomey talked about attrition. You know, we probably have about a 10-12% attrition mark, and we noticed in the last year we've had more than ever than we've had. In general, fire services across the nation that have EMS-based ambulances are seeing more and more of a retention issue. And it's because there's kind of an EMS staffing shortage when it comes to paramedics out there and firefighters across the nation. So what's happening is a lot of your volunteer fire departments are recruiting some of these, I take that back, the career smaller departments are recruiting some of these volunteer fire departments staff. They come and get recruited, they work for us. We might get some of those through the Lake Area Tech program, through a 2-year program. And then what'll happen is sometimes the larger services like Sioux Falls, like St. Paul Fire Rescue or Minneapolis Fire, Rochester, those bigger services, Rapid City, are looking for these highly trained individuals. And we're, fortunately I should get for them, we're offering individuals with a lot of hats when it comes to training that comes within the department. So, and people ask, what is the difference between an EMT versus a paramedic? When you talk about paramedics versus EMTs, EMT basics, they can do, for example, a cardiac arrest call. I was just talking to Chief Youngblood about this morning. An EMT basic, when they come to a cardiac arrest event, they can start CPR, they can use an AED, an automatic external defibrillator, and probably do a little bag valve mask ventilation, but that's pretty much it. Paramedics, when they get on scene, what they can do is they can create and intubate or put an advanced airway into their trachea and secure their airway so they don't aspirate into their lungs, and they can start IVs. They can do interosseous IVs, and those are a little bit more high level when it comes to going into your bone marrow. We could do tracheotomies, we could do needle decompressions, but just as important is the pharmaceutical drugs that we have. EMS Chief Langer probably can tell me, how many EMS drugs do we have in one of our EMS kits? 40, 50?
Yeah, 30, 40.
I mean, that's a pretty large amount of pharmacology drugs. And people would say, well, what does that mean? Well, that means we have to be trained at a high level emergency registered nurse level. And so that training basically results in about a 2-year associate's degree to get that to that level to be a paramedic. But I tell everybody, and I've shared this with Assistant City Manager Mitch Stagger about what an ambulance really is. An ambulance is an emergency room on wheels. When it comes to the scene of an incident, we are bringing a high-level emergency response team to the scene. And when they get on scene, they're stabilizing these highly critical patients. And I was sharing this morning that the majority of the time when we leave the scene, the ambulance is not going lights and sirens, and we're following all traffic laws to the hospital. Majority of the time. Why? Because they're stabilized before they get to the hospital. Not saying they're fixed, they're not better all the way. They're getting to the hospital and they're seeing an emergency room physician and they're being evaluated because a lot of the things that were going wrong at home are doing better. So that's kind of the difference between what an EMT is and a paramedic, respectively. Okay, onward. Now I want to talk a little bit about our calls for service. Is that the one? Yeah, okay, that's the same one. You guys changed it up a little bit on me. Okay, so when we talk about calls for service, obviously when Chief Toomey talked about the amount of calls that are coming into the 911 center, we also have calls that are coming into the 911 center, obviously for an EMS ambulance incident, a fire incident, those kind of things. In 2025, we responded to 6,787 calls for service. And those types of calls for service, as you can see on the graph, they're identifying EMS calls, which are ambulance. We did 3,251 of those. The fire ones are about 1,094. The airport coverage calls were 994 calls. And then, of course, inspections are also a call for service, which is just a little over 500. So in that time frame for the last 5 years, we've jumped more than 16% in calls for service in that time frame. And our EMS calls, last year we had a pretty significant jump. We did 3,018 calls of service in 2024 to 3,251. You're probably wondering why such a major increase in one calendar year, because you can see we were kind of flatline. Back in 2021 and 2022, or 20 to 21 to 22, do you guys remember what was going on for the whole country? COVID. And so we had a huge influx of calls during that time. We kind of jumped up pretty high and quickly, and we kind of stabilized. We actually went down a couple years there in a row, and then we popped back up. And now I'm thinking what we're going to see is we're going to see the normal number rise, jump from 5 to 6% per calendar year going forward. So we've hit that number and we'll continue to rise. some of those calls for service that we have on the ambulance side are roughly trauma calls. We went on over 500, and you probably wonder, what is a trauma call? A trauma call could be somebody in a car accident, motorcycle accident, bike accident, a fall, maybe a fall off a ladder, anything that would hurt you, right? Injury, that would be a trauma call. We went on more than 300 plus cardiac, stroke, coronary events. We also went on over 140 plus respiratory calls for medical. And then of course there's the behavioral stuff that we went on, more than 500 of those. And medical in general, and that's many different types of calls, from a seizure patient to a diabetic patient, maybe just a sick in general patient, somebody with influenza, some type of virus or whatever. More than 1,800 of those calls were part of that. So some of this information will be found on the website that Kelly put our PDF on. I think she might even send that to you guys a little bit later when it comes to our year-end report. So unfortunately, I didn't have enough of these around the room to give to you guys. Okay, so fire calls in general, we ran on, like I said, over 1,000 plus of those. And statistically speaking, the type of calls that we went on, well, we had 64 fires, real fires that we went to, meaning structure fires, home fires, mobile home fires, vehicle fires, wildland fires, any type of those type of fires. And what comes with that, we do investigations on all of those. A little bit later, I'll touch on fire investigations, but we did almost 70 of those. And one of the things of the 1,000 calls that we go on is EMS assist. A lot of you have probably seen the ambulance going lights and sirens to the scene. A lot of times you'll see the fire engine truck leaving and following behind it. A lot of times they're going with normal traffic signals and are following traffic laws until they get to the scene. The reason we do that, not only at Watertown Fire Rescue, but across the country, is the viability of patients' survivability is much improved if we bring more boots to the ground, staffing. And what I mean by that is paramedics, because the majority of our staff at Watertown Fire Rescue are paramedics. 2 years ago, we were 100%. This year, we've had a couple retention issues that have occurred with us, and now we're about, what did you say this morning, Scott, 36 out of 40?
Yes.
Are paramedics. So 36 out of 40 of our staff are paramedics. And we took a high reward when I was going to conferences telling people to you'd be standing up and say, who's here, 75% paramedics, firefighter paramedics. And I'd be one of the last ones standing, and we're still there, but hopefully we can continue that process. But when it comes to the viability of that patient from that EMS assist, is we're seeing a much improved number, and they say 77% of patients that have more paramedics on scene have a better outcome through the patient viability process. Okay. And of course, of that call volume up that you're seeing is airport coverage. You're probably going, what does that mean? Well, Watertown Airport has to have a fully functional aircraft rescue firefighting. You guys have seen the wonderful fire truck out there. It's yellow, right? You have to do 2 big crash trucks out there. Well, the commercial airlines, by FAA law, say we have to have a on-site, not 24/7, for every commercial airline that comes in. So arrival, departure, we have to have somebody there throughout that process. And we consider that a call for service because that individual is totally out of service and is basically manned that truck until that plane departs. So that's part of one of our calls for service. And then of course, inspections, we'll touch on that here in a minute.
Other way.
Oh, I went the wrong way? Sorry about that. Okay. Let's touch a little bit about our fire prevention process, and we'll get into the risk reduction a little bit, how that works for us. Now, our fire prevention program has been going strong now for many years, and I don't know if you guys know, I think Fire Marshal Bloom told me we had more than 2,000 commercial businesses in and around the city. And what does that mean? Well, National Fire Protection Agency says we should be going out and inspecting every one of them every year. Now, we do not have the staffing, or do I think anybody across the nation meets those standards. It's a recommendation, it's not a requirement, okay? But we do get out and do as many public safety inspections that we can. We did more than 500 plus last year, What does that mean? That means he's going out and getting into those buildings and actually going through and finding anything they can help with. Obviously, there's violations sometimes. We have to go back and do a reinspection. But the point we're trying to do is make the building safe for the people that live in it. But more importantly, it does cut down on structure fires. And you and I talk about structure fires all the time, don't we? We're seeing a lot less, but that's a common theme across the nation, everybody. The fire prevention bureaus, that's what their job is to do, to prevent fires. He's also involved with his fire prevention team in building plan and project consultations. He did more than 458 of those last year. And what does that mean? The fire marshal works closely with the community development manager and her team, the planner, the city planner, working with the building official, going out to review those buildings, and then also with the engineering department in identifying addressing. We actually do the addressing for all new developments within the city. Anywhere that happens, and I think that was probably a good move that the city manager had us take on that role, and we've been doing that now for the last year, I believe. He's also involved in the department review design team and looking at obviously the building design, the schematics, the specs, looking at water mains that are coming to that structure, hydrant layouts, and targeting what areas are going to need more hydrants for specific facilities. Sprinkler systems, we're looking at those routinely, the plans, and also the alarm panel plans that go with that specific building. Public education is a really big thing within our department, as well as any public safety area, even our police department friends. When it comes to public education, we do a ton of fire extinguisher classes throughout the community. We get into our assisted living, our senior living folks. We identify how to provide a good fire escape plan. We talk about fire safety. A lot of times we get into those areas, we're talking about first aid in general, and just a lot of different little things that we can do from a public relations standpoint to help their days go better in some of those senior living places. We get into the third graders every year. More than 300 kids go through the Children's Fire Safety House, not only here in the Watertown area, but we also do outreach within the lower, some of the smaller communities as well. October is definitely Fire Prevention Month, and we get into numerous elementary classes throughout the whole month, identify doing classes, and also work with a lot of those students as well. And like I said, the structure fires that we go to, the building fires, home fires, mobile home fires, vehicle fires, wildland fires, they do require investigations. Not only do we do the investigation internally, we also work with the South Dakota Fire Marshal's Office with those investigations on a routine basis. Another thing that's really important for risk reduction is the smoke detector program. My colleague over here, City Manager Stager, got to be a part of that this last fall. We got into more than 300, well actually we installed 328 plus detectors in more than like 70, 80 homes. And we do that every year. And that's one near and dear to my heart because we have been learning that smoke detectors save lives. Everybody knows that, right? Well, for example, I believe like 8, 9 years ago, I was at a mobile home park and installed a bunch with one of my colleagues. And 2 weeks later, we had a fire in that mobile home that I installed in. The great thing about it was we had 7 people that were in that house or that trailer, and one of those little kids said, "That smoke detector is what woke me up." And there was smoke within the house, and it was in the water heater area that the fire started at. And those kids got out of the house safely because of that smoke detector. So a great program that we have out there. Another program we have is called the Public Access Defibrillator Program. We started that way back in 2007. Roughly speaking, there was more than 15 defibrillators, those automatic external defibrillators, just like up on the wall back there. We went from 15, and today I believe, Scott, correct me if I'm wrong, 250 range in around the community as well. That Carly Ardall is one of she's our pad coordinator that we have around the community. But even the best part is, even then, and my colleague probably could share with me, that we did not have defibrillators in our squad cars way back then. And that stated, we saved lives, not only because the defibrillators here at this facility, but just as important is we're not getting on scene on time to these places. And our patrol officer friends are getting there quicker than our mobile ambulance units, and they're able to get that defibrillator there to help with that viability of that patient. Some other quick things of note from 2025, we had the State Fire School for the third time in a row here in Watertown. We coordinated that event with Lake Erie Tech College, and more than 550 plus students were here, or firefighters from all over the state. And what does that mean for the city of Watertown? Well, I think that means money. I mean, our hotels are full, our eating establishments are getting busy, and firefighters like to maybe partake a little bit, I think, maybe at some events. But that stated, I think it's a really good thing, from not only from a business economic boom, but also from a sales tax structure for us as well. We're also a clinical paramedic team for our preceptor program at Lake Erie Tech College. The paramedic program brings a lot of our students to Watertown Fire Rescue. We have paramedics that are preceptors that help train. These paramedics that have to go through the program have to go through 10 plus days, which is 240 hours of clinicals and numerous advanced life support contacts in order to meet the standard of that program. And also, we're involved in a lot of shadowing with high school students through the Northeast Tech, as well as EMT students that shadow as well at our department. And just one other thing too, last year we started the ISO audit back in November, I believe it was, and that process is being completed as we speak right now. And I'm thinking probably by April or early May, we'll be getting to that finalization of what that looks like. And the ISO audit is the insurance service organization, and that is the public protection classification grade that we have. Currently Watertown sits at an ISO 2, and it looks, it looks favorable, but hopefully we don't fall down in our protection class, because that unfortunately could cause an insurance jump for commercial or even residential insurance policies. Okay. Oh, and just one other note, last year we took delivery of our new ambulance, our Medic 3, and we also took delivery of our Wildland brush truck, fire truck. Okay, last but not least, I'm going to touch a little bit on Station 3. So, as you guys can see up here, thank you for doing that piece, Mike, with Alan here the other day on the sign. I saw you saw that, because you and I have talked about this a long time, haven't we?
A long time, yeah, for sure.
So obviously this has been something that we've been looking at from a response time standpoint for the Watertown Fire Rescue and the city of Watertown. And it's not for the department, let's be clear, it's for the citizens of our community. The northeast and southeast part of the city has always been something that has been lacking for response times. We average anywhere from 8 to 12, 13 minutes of response time in those areas. And as you can see up there, the land that was purchased in September, I believe it was, range. And thanks to our council friends, our mayor, and city manager Stager for pushing that through and getting it bought. And we did this because it was land that came available, and we knew that it was potentially going to be bought outright, and we knew that this was the best logistical spot. We did a lot of response time graphing and research over a 2 or 3 year period, and realized that this was going to serve us for 50 plus years. People are going to ask me, well, how many calls for service would you have? Well, as you can see up here, jurisdictionally speaking, we can change that any way we want. But that stated, we've used this same boundary lines for quite a few years now. And that's going to be about 1,000 calls, or a third of all ambulance calls, those 3,251 ambulance calls. It would represent almost 1,000 ambulance calls for service in that specific area. Roughly speaking, it would also be about 350 plus fire calls in that specific area as well. So it will serve a huge, huge purpose and get our EMS vehicles there quicker. And again, the American Heart Association Change of Survival Link states this: in a cardiac arrest event, the first thing you need to do if somebody's unresponsive is to call 911. The second thing is early CPR. So we want to get that hard and fast compressions going to get the blood moving to the core organs of our body, the heart, brain, and the lungs. Third thing is the AED, the automatic external defibrillator. Well, my patrol friends are going to be on scene quicker than us, right? And the fourth is the emergency room on wheels, that ambulance, because we're bringing that high-level trained paramedic team. And then obviously the fifth one's the coordinated efforts at our hospitals, either here or obviously airlifting somebody to Sioux Falls or something like that. But that chain of survival link is the thing that we have to look at, and this response times at Station 3 will be vitally improved through that process. So some of the things, again, that we're looking forward through 2026 is going to be the ISO report, continuing what this looks like, and people could say, well, when is it going to happen? That is a really tough question to answer. I think the answer to that is we have a revenue shortage within the city of Watertown, and we have to look at how we create more revenue in order to add staff. We will need 9 people to house that new station. 9, 3 people per shift. And that will be an ambulance and a fire truck out there, as you can see. Matter of fact, that picture you see up there is the actual fire station down in Sioux Falls. It's Station 12 down in the southeast part of the city. But that stated, that would house 3 to 4 people at that station every day, 24/7. And 9 people would cost us $700,000, city manager stagger, roughly. So how do we get there? Well, the theme that we've been seeing and looking at is we go on 270 plus ambulance calls outside the city limits every year, and we are looking at possibly going through with that ambulance district at some point in time. Is that this spring? Is it at the next general election? I don't know, but that'll be something that we'll be looking at and taking a deep dive in, not only with City Manager Stager, our council friends, and the county commissioners within the city. So with that, I'd stand by for any comments or questions.
When you break down, I was going to ask about the number of calls that were inside city limits and outside, so you did just answer that somewhat. You said 270 ambulance calls. Does that factor in fire calls, the other things as well? I mean, even educational pieces, people go outside of the city limits to go to some of the surrounding...
To educate?
Yeah.
Time to time, Mayor. Yeah, so when it comes to fire calls outside the city limits at 1,000, when you're talking car accidents, because we do go on numerous car accidents outside the city limits, and structured fires are limited. We don't have a lot of structured fires outside the city limits, but we do mutual aid with other local fire departments. So to number on that, I believe, I know I have it right here. Last year, we had just under 100 with those fire calls outside the city limits. Yep. Yes.
The other thing to remember that is we also have other fire departments in the county where we don't have any other ambulance services in the county. So we are the ambulance service.
And we cover 9 townships of the fire district within Cottington County. For the ambulance district is all of Cottington County. And we encompass 17 townships and 5 villages, 5 cities.
What kind of reimbursement do you get for calls outside the city? Whether it's ambulance or fire or whatever, because that shouldn't be a cost that you have to absorb.
So currently, right now, we have a township agreement for those 9 fire townships, or those townships within close proximity of City of Watertown. Roughly speaking, it's like $35,000 that we receive annually. And for
From each or combined?
Combined 9 townships, $35,000. And the revenue that we receive from the EMS township for township providing services in the cities is right around $23,000. And when you talk about ambulance calls for service, and we go to those 270, we probably, every ambulance generates an ambulance bill, and I know people ask me how that works, but on average, if we have a Medicare call, we receive 40% of a generated call. So if it's a $1,400 call, EMS chief, correct me if I'm wrong, $600 is what we receive?
Roughly, yeah.
Yeah, so it's a limited amount. And every call's about $550 to $600 a call to go outside, at minimum, to just put the lights and sirens on to go, so. Good job. Yes, Tucker.
We're still years out on this station project?
Well, that is hypothetical, isn't it?
There are many things going on with EMS right now. The legislature this year authorized a summer study to look at EMS funding throughout the state. And that's really one of our big challenges is it's the Medicare issue that Don just described. We've got similar issues with Medicaid,
45%.
and even lower reimbursement reimbursement rates with some of the private payers. So it is a real funding challenge that everybody faces, which is good because we can all face it together and ensure that we've got the essential service in place.
Senate Bill 89 is the bill that City Manager Stager was referring to.
Don, to what extent are your firefighters and paramedics cross-trained to do each other's jobs if they need to? Or
Every
are they
one of
not?
them, 100%. And I would let Assistant Chief Youngblood maybe answer that question more appropriately. But more than 7,000 hours of training, and am I right by saying that everyone can do the same job throughout the department?
100%.
Yep.
They're cross-trained in all duties.
Yes, Doug?
I just wanted to say thanks to both of you gentlemen for the reports. It's one thing to pass out a report to people for us to read, which is useful, of course, but I appreciate you going through it and highlighting important aspects of it. And then just one last question, why are people always running into houses? Just kidding, you don't have to answer.
Probably alcohol related.
Anything else?
Chief, I got an easy question, but it's one that I just learned about what Watertown Fire Rescue does is some of the awards that we give out, like the Life Saving Award, is, I just think that's so fantastic when you have someone that is working with you and for the citizens of Watertown and you're going out and actually saving lives. And it seems like such a small reward that you give them when you recognize them with a little ceremony and sheet of paper, but if you could just say something about that for the people of Watertown, I think that's just amazing what you do.
Well, thank you for sharing that. In the fire service, we're generally pretty humble people. We don't look to, compliment ourselves or pat ourselves on the backs or anything of that nature. We just had our awards ceremony back in January, and correct me if I'm wrong, Chief Youngblood, was there 8 Life Save Awards that we gave out to? Somewhere in that range. And what does that entail? Basically, a life save for us at Watertown Fire Rescue is we take you to the hospital in a very high critical emergency situation, and they walk out, especially if somebody's been in cardiac arrest. We need to see them do well at the hospital, maybe even definitely leave the hospital, and they get that life-saving award. We give baby delivery awards as well, so which is kind of fun, and there's some real cool positives of that too. But yeah, our staff is the #1 asset, and I'll never speak any differently than that. So thank you for sharing that.
I want to top that off, that it's not just an award the chief gives, that's an award that's selected and approved upon by mentors. There's a committee that's put together by the staff that goes through and reviews those and actually see if they warrant that life save. It's kind of a different topic, but that's our job to go do our job, right? But there are those extenuating circumstances in the special cases or our cases that to get a life save from are pretty remarkable. And like I said, we had at least 8 of those instances that were awarded last year.
Just one last thing, for both you chiefs and everybody who works with you and for the citizens of Watertown, my heartfelt thanks on behalf of everyone in Watertown, because it really is the bedrock of everything that we need to have in Watertown. I always say quality of life is what we aim for here in Watertown, and that means a lot of different things. But it means nothing if you don't have safety of life and safety of just living your life here. So thank you.
Thank you.
And I think when you're asking about equipment needs and stuff like that, to Chief Toomey earlier, Mike, I would tell you that our elected officials, as well as City Manager Stager, they make sure we have the necessary equipment to provide that safety to our citizens in our community, and they go above and beyond by helping us with that. So thank you again for that.
Now, we are quickly running out of time, but I'll maybe address just a couple of things before we wrap up. Our upcoming council meeting on Monday night, just to foreshadow some things that we will have on that agenda. We will have a presentation from the First District Association of Local Governments. That's an annual report that Todd Kays will be giving. We have 2 contracts to approve. One is a lease agreement renewal on the Derby Downs property. And then secondly, we have a bid opening tomorrow morning for a front-end wheel loader. And we'll be issuing the formal agenda after that bid opening, but we do anticipate approving that. And then a couple of public hearings or second readings. We're looking at a resolution of necessity for sidewalks on 5th Avenue North. That's associated with a street rebuild. And then we have a second reading on 2 of the ordinances and rezoning related to Harmony Hill. And then finally, we have 3 liquor license transfer related items. One is transferring a license from Sandy's Bar and Grill to Infinity Fun. And then secondly, 2 licenses associated with Watertown Brewing Company will be transferred to new ownership. So pretty light agenda on next week, Monday, but look forward to having all of you covering that meeting as well. Finally, I'd like to just open it up and ensure that each of you has an opportunity to ask any questions. We would really like some feedback on going forward, how we can better communicate with you as important media partners in the community, and how we can use similar type of events to do our jobs together more effectively and efficiently. Any questions?
Do you have a timeline for Station 3? Like, when's this gonna, when you're breaking ground, Don?
It'll be a couple of years.
Okay.
So the next step is actually a street facility, which we have the majority of the funding. We anticipate some news on that by the end of June. And then we need to complete that facility, replenish some of the CapEx funds, and then we could start to look at launching the capital for a fire station. It's not really the capital that's the tough part with that project. It's the additional 9 staff members, which will come through a revised view of funding, whether it's from the state or something we do locally.
Hopefully soon.
When I talked about the quality of life and how everybody works together, you guys are included by sharing the good stories of Watertown. So thank you for what you guys do as
Good
well.
point.